Okay, good morning and thank you for joining us for the City of Lubbock COVID-19 News Conference. Our panelists today are Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. We'll start things off with Catherine Wells.
Sorry, I had my phone on mute. Today I'm going to update you on our current numbers of COVID-19 cases in Lubbock County and some of the activities of the health department this last week. The health department is now reporting 955 cases of COVID as of yesterday afternoon. This is a significant increase in what we were reporting the previous week. 566 individuals are currently recovered, but we now have 338 cases. In prior weeks, we had less than 200 active cases in our community. Over the last week, we saw our highest increase in case numbers with 196 new cases in a week, and yesterday was the highest number ever reported in one day at 61 cases. The majority of the new cases are in young adults, 18 to 25. It's actually 58% of the cases we had over the last week are individuals in this age group. Research and data on COVID-19 at this time show that most of these individuals will do fine. However, the concern is that they will infect those who are more vulnerable, such as visiting their father, grandfather, or uncle this Sunday on Father's Day weekend. Controlling the spread of COVID-19 requires our entire community. Please be smart when you're out. Frequent businesses that have controls in place, practice social distancing, and wear that all-important face covering. I've said that we've worked over the last couple of months to encourage people to wear face coverings. More and more data is coming out to show the importance of these face coverings. I'm wearing one, my family's wearing one. We actually require face coverings of all staff at the health department, and I encourage you all to do the same. We can't continue to have weeks like this. If we continue to see this many cases, we're going to start seeing increases of number of people in our hospitals. That includes my update for the week, and I'll now pass it over to Dr. Cook. Thank you.
Thank you, Catherine. Let me just reiterate some of those things that Catherine said. You know, many of these people are young. However, they will do very well. Most of them are related to, most of the infections are related to areas where they went and were not socially distanced. They weren't wearing facial coverings. And as a result, because this virus has such an infectious nature to it, 2 to 3 times what normal flu or some of our other viruses have, it can make a number of individuals ill in just a short period of time. And that's why we see this spread. I'm concerned about the number of cases that we've had in Lubbock in the last week. And so there are things that we can do to stop it. And I'll talk about those in a minute. Again, our biggest fear is really related to those individuals in these young patient populations. They're not that symptomatic. And then they have other jobs and they go to their jobs and then spread it amongst their colleagues at work. And then we have to shut down those institutions where they have to go and clean. And then we have to isolate other individuals because they were potentially exposed. What we don't, and what I fear most, is that these infections will get back into a skilled nursing facility, a long-term care facility, or a nursing home, or in patient populations that are so vulnerable to this virus, and that those individuals won't do very well, won't do near as well as somebody that's younger. Now, younger people can still get very sick with this virus, although not to the same rate that somebody who has those vulnerable conditions that put them at great risk. Our greatest risk right now is just complacency and apathy about this disease. So please, please pay attention to that. You know, as Catherine mentioned, it's Father's Day weekend. And I want to see my sons and my daughter-in-laws. And when they come over to eat, we're going to practice social distancing. They don't live in my house. And we're going to practice social distancing. And when appropriate, we're going to wear facial coverings. And so If you care about your loved ones, you will do the same thing. We must take care of those other people. It's not always about us. If you're an employer, please be diligent about screening your employees. Pay attention to those sanitation protocols. Make sure that people are comfortable telling you that they don't feel well and that they need to go home. Don't make them stay and work and infect other people. We must respect this virus because of its ability to infect others, the ability of the virus to cause disease and suffering, and we've seen even death here in Lubbock related to this virus. However, we must not live in fear of this virus. We must embrace the new paradigm where we have social distancing by second nature and that we wear facial coverings by second nature. This is our new paradigm in this pandemic, and we must start it now and continue it. This virus is not going to go away, but it's our new way of life, our new paradigm. This is not a sprint. This is a marathon. And we are West Texas Strong. We grew up out here because it builds character to be out here. And we can do this. We are West Texas Strong, and we can win this fight. And please remember, it's not about you. It's about your loved ones. We don't get to pick who dies from this virus, but I can choose to protect them by social distancing and by facial coverings. It's about your loved ones. Let's make sure we social distance. Let's wear our masks, wash our hands, and keep everybody healthy as we can. Lacey, it's back to you. Thank you.
Thank you, Dr. Cook. And now we'll hear from Lubbock Mayor Dan Pope.
Good morning. Thank you, Lacey. Thank you, Dr. Cook and Ms. Wells. I continue to appreciate your very capable leadership. I want to start by putting a little some of the data to what both Catherine and Ron have talked about. So if you'll bear with me for a moment, I'm going to share my screen with you. So let's start with active cases by day. You see the spike here. This is one of the numbers we've been following. This is probably even a better way of looking at it. That's our new cases by day. You know, one of the things that made us feel confident about reopening was our ability to control the spread of COVID-19. And if you look at the period of time between mid to late April and about 10 days ago, we kept our spread very low. In fact, the vast majority of those days under 10 new cases per day. Now, we continue to watch hospital data. The orange line is trending down. That's good. That means our hospitals are getting busy or busier. I don't think you would say busy yet. Remember, our hospitals are safe. They have care available. If you need to go to the hospital, go to the hospital. The blue line is the line that we take a lot of solace in. That's our hospitalizations. Yesterday, we had 14 hospitalized patients, 7 in ICU, 7 on the floors. We'll continue to watch that number, but that is still a very positive indicator. Now, you've seen this slide. This is our test by date, and then the positivity rate in orange. I'm going to show you a new look at this because this is the last 7 days, and you can see the remarkable numbers of tests that have been done. From a high of 768 tests on the 10th. Certainly Sunday we only did 250 tests, but you can see the number of tests. But we've been watching the positivity rate, and it's been going down, and it's gone the other way this week. Now, we don't like the trend. However, it's still not in a 911 kind of area. In fact, the state's goal is to have this below 6%. Even with the cases we've reported in the last week, our positivity rate, if you look back at the last 7 days, is still just around 5%. So the barn is not completely on fire. We do have concerns, and I don't want to be mentioned as sort of waving this off. Finally, case count by age the last 14 days. I went back 14 days because that's where we saw bars start opening, and we started to see some of this behavior that has been less than acceptable and is very much controllable. You can see this reflects that more than half of the positive cases in the last 14 days are in one age group. Okay, when you add the 10 to 19, it's even a larger percentage. Okay, that's enough on the slides. Okay, I believe I'm back now. So let's talk about the big picture. You may have heard the governor talk yesterday. The governor talked about the fact that we're going to have to coexist with a coronavirus. You know, we made decisions around reopening based upon the fact that we had learned how to slow the spread. We talked about facial coverings. We talk about our social distancing. We talk about washing our hands. But most importantly, we talk about using common sense. We need to, you need to avoid large groups. Hang out with the same people you've been hanging out with. Use good judgment. We're thankful that TABC, the Texas Alcoholic Beverage Commission, with the governor's support, mentioned yesterday that they will be aggressively working with our bars. And that if they're not following the governor's order, and by the way, they're the only ones that can enforce that order. They're not following that order, that there's not a first slap on the wrist, that the first infraction is a 30-day suspension of their license. We need that. The vast majority of our businesses, our bars, our restaurants, have taken this very seriously. In fact, nearly 2 handfuls of them closed down yesterday on their own to do extra cleaning, and a number of those have asked us to help test their employees, and that's something that we will readily and we're very willing to do. Now, we've had a couple that have not been very good actors, and we've taken, and on our by our initiative, taken action to close them while they test employees and while they clean their establishments. Those places, as they reopen, will be watched very carefully. We've got to slow this spread. We have some sports tournaments in town this weekend, a 3-on-3 soccer tournament and a softball tournament. We've seen their protocol, their safety plans. They've done a very good job in preparing for this weekend. We need to learn from these events. How do we expect to play football this fall if we can't have 1,000 people at a softball tournament? So we're going to learn and we'll tweak and we'll get better every week. We are not going back to shutting down, but we've got to move forward safely. I'm so thankful for our businesses that have reopened safely. In fact, I talked to one restaurant owner yesterday who opened his dining room for the first time last weekend and was so frustrated by some of his clientele and their lack of willingness to take this seriously that he's decided to close his dining room for the foreseeable future. He'll continue to do takeout. That's his prerogative, and we applaud him for keeping his employees and his customers safe. Back to what Dr. Cook talked about around the implications. We have a large bank branch, headquarters branch in our community closed down this week because a part-time employee who visited one of these establishments that I talked about previously is COVID positive. And their protocol said they're going to close things down for a week to protect their employees and their customers. I've heard from a number of other businesses that are dealing with the same situation because of this spread in our community. The implications are significant, not just to businesses though. It's to the people that we touch in our daily lives. It's the impact we have on our neighbors. And I think most importantly, it's to our loved ones. Father's Day is Sunday. We need to be very careful about the way we gather with our families, with our fathers and our mothers, our grandparents. Please, please do this the right way. I'm so thankful for each of you. You'll see me wearing my face covering. And this is one that one of my friends gave me that says #thank you. Thank you, West Texas. Thank you, Lubbock. Let's do this the right way. Let's reopen safely. Let's protect both lives and livelihoods. God bless each of you. Back to you, Lacey.
Thank you, Mayor, and thank you to our panelists. Now we'll open it up for media questions. Our order today is Karen McKay with KCBD, Christy Martinez Garcia, Latino Lubbock, Mateo Rosales with Daily Toreador, Alyssa Tellez from KLBK, Brady King, Fox 34, Matthew Stell, KMAC, Casey Ellingson, Texas Tech Public Media, Matt Dotre, the Lubbock Avalanche Journal, and Olga Aguero with El Editor. So let's start things off with Karen McKay.
Good morning. I have a question first for the mayor and then for a medical question for Dr. Cook. Mayor Pope, we have just learned minutes ago that as San Antonio has these same kind of virtual meetings weekly on COVID-19 in their area, that Bexar County Judge Nelson Wolf just announced an executive order saying that businesses will be fined if they do not enforce masks throughout their business for employees and customers that do not social distance, and that fine could be up to $1,000. Do you see fines coming here for the same reason if businesses do not require masks in areas that should be?
Yeah, so thanks for your question, Karen. I'm not familiar with Judge Wolf's action this morning. We've not talked about anything like that. We've, as you and I have talked throughout the last 100 days a lot about this. I do think we can do it the right way and do it without fines. The governor had a question about this yesterday, and I think the Dallas County judge asked the question, and he mentioned fines in his answer. It was not real clear to me, but that's not on the table with us right now. We think we can do it in a responsible way where individuals and businesses can take the right approach.
All right, thank you. And a medical question for Dr. Cook or Catherine, whichever. We're hearing a lot of people, they're telling us that they went through this and had COVID-19 weeks ago, they recovered, and now they're feeling sick again. They've gone back in, they've been tested, and they say that they're getting it twice. And originally we thought that wasn't possible, but what are you hearing? And now are you learning that that could be a possibility that people could get this illness twice?
Well, Karen, we just don't know yet. That's a great question. I heard on the national news this morning about somebody that had that very scenario. As far as I know, it hasn't happened, but we're still waiting for some of that research to come about. We don't know that when you develop antibodies, are they protective antibodies against the disease? Usually antibodies are protective. However, there's cases where sometimes the antibodies that we make against a disease are not particularly protective. All the more reason why we get a flu vaccine every year. And so as a result, we'll just have to wait and see. And all the more reason to do social distancing and hand washing and facial coverings. I'm always going to come back to that, right? No matter what answer I give you, I'm going to include that somehow. So, but as a result, we'll just have to wait and see. So just when we think we're protected, we may not be. We'll just have to wait for some more literature to come out. I've not seen anything in the literature yet, just the anecdotal incident on the national news that was reported.
All right, thank you.
You bet.
Okay, now we have Christy Martinez Garcia with Latino Lubbock.
Good morning, everybody. I'm Christy with Latino Lubbock Magazine. I know that we're all learning from this pandemic, but probably right now the divide on masks or face coverings, which have proven to be effective, Mayor, I've asked you about this before and you said we didn't have time to nanny the public, but beyond the ordinary degree of efforts by the city, what message can you extend to the doubting public and even businesses who are not enforcing the use of masks to address this?
Well, that's a good question, Karen. Christy, it's a good question. We spent some time last night doing some planning around messaging. I think you'll see us in conjunction with Texas Tech change some of our messaging and refresh it to try to drive home the importance of facial coverings. We realize that as much as the traditional media resonates with people my age, and that a lot of our younger folks, we've got to reach them a different way. And so that's something we'll be working to do. But we'll continue to talk about the significance of these precautions that need to be taken. We do learn more about this every day. And that's the difficult thing, just as the question that Dr. Cook just answered. The unknown is what challenges us, but we will stay the course and continue to talk about the safety precautions, the protocols that keep individuals, employees, clients, our community safe.
My next question is, with the major increase of infections and citizens that have become sick due to COVID-19, shouldn't there be an equal, if not more, increase of concern of how to address this with the universities returning? I mean, are we going to apply what we've learned? Which, I mean, we always haven't. And I know that we're all committed to bringing those numbers down and bringing that education to the community. But these students, this is alarming as they will be returning back to Lubbock.
Yeah, so I think it's a great question. First and foremost, I have a lot of confidence in the leadership of Texas Tech and Lubbock Christian and South Plains College and Wayland, as well as our school districts and our private schools. They take this very seriously. You've seen some protocols be announced already about reopening. You'll see them modify that, I believe, as they learn more. We're in constant communication, and we will continue to be a good partner when it comes to that. So much of this messaging needs to get to parents of 18 to 22, 23-year-olds. And I know that a lot of our communication as parent to a child that age is often blah, 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 blah. However, I think we can tie it to the impact it has on people that they love. And I think that's so much of the message. And that's why you heard us stress that around times we get together generally as families, Mother's Day, Father's Day, Memorial Day. We'll continue to share that message. Ron said it well a minute ago. It's not a sprint. This is the long haul, and it's maybe an ultra marathon, not just a marathon. We'll stay the course.
Okay, thank you, Christy. Now we have Mateo Rosales with the Daily Toreador.
Good morning. So I have two questions for the mayor. With the first question being, with the rise in COVID-19 cases in Lubbock, is there a possibility that Lubbock is going to have to reduce occupancy for different businesses? And will there be tighter restrictions, or are we going to keep the normal course?
Mateo, would you ask that question again? You cut out there for a moment.
Yes, of course. So with the rise in COVID-19 cases in Lubbock, is there a possibility where our businesses will have to reduce occupancy levels back to 25%, or are we going to stay at 50% occupancy?
Well, a good question. That's not in our control. That's the governor's call, and we'll honor the governor's order on that. But based upon what he said yesterday, I don't expect us to back up. I think we know how to control the spread. We need to act the right way.
Okay, thank you. And my next question is, what is the city doing to prepare ourselves for the rise of Texas students coming back to campus? And is the city going to ask Texas Tech to do any more precautions than what are announced?
Well, I think everything we do and have done since March 12th is in an effort to prepare our community to deal with COVID-19, whether that community member is 90 or 19. And so we'll continue to do that. Texas Tech, specific to your question, has been a great partner. They set a very good example when they closed their campuses, when they closed it not only to students, but to faculty and to staff. I have no reason to believe that they will be a great partner going forward. It's about safety. It's about safety of the kids that go to school at Texas Tech, the people that work at Texas Tech, and the people that live in Lubbock.
Thank you.
Thank you.
Thank you, Mateo. Now we have Alyssa Tellez with KOBK.
Good morning, Alyssa Tellez with KLBK News. My first question is for Dr. Cook, and then I'll follow up with Mayor Pope. So we had a viewer call in yesterday about her daughter, and she says her daughter is working at a place where they're telling employees not to wear masks, but she continues to wear one. She lives with her mother, who is high risk and doesn't want her to get sick, but she is continually getting patronized for wearing one. Dr. Cook, despite her employer telling her she doesn't have to wear masks, should she continue this practice?
Oh, absolutely. That's a great question. A good example for many of us to hear. You know, sometimes we get peer pressure or employee boss pressure to do things that are against good common sense. And so right now, the recommendation is, and common sense says, that wearing a mask decreases the spreading of the virus to others. And so absolutely, that employee should continue to wear a mask, especially given the fact that her mother may have some kind of at-risk disease that may make her potentially not do as well with the infection. So absolutely. You know, there's other things that a person could do when they get home is change clothes, bathe, change masks, you know, those sorts of things. To even decrease the rate of infection further when she's around her mother.
All right, thank you so much, Dr. Cook. And Mayor Pope, what protections do employees have in situations like this where employers are telling their employees maybe not to wear a mask?
Well, certainly the employment law is not a city function. That's a federal, a little bit state, but mainly a federal function. I would suggest an employee that has that problem to reach out to the health department and to talk through protocol with the health department, and let's see if we can't help that employee and that employer. Sometimes it's just a matter of education.
All right, thank you so much, Mayor Pope.
Thank you, Alyssa. Now we have Brady King with Fox 34.
Good morning. With yesterday's press conference, several businesses were identified as possible exposure sites. There are more that we've been told about that have not been identified by the city. So do businesses have to inform the city about exposures if an employee or customer tests positive? And what's the transparency about those new cases?
I'll go ahead and take that one. There's lots of cases right now with 61 coming in yesterday that are still under investigation. All positive cases are reportable to the health department. So it's not up to a business to decide whether or not to report to us. We conduct an investigation and question that individual that was positive about their exposure sites. And then, we do depend on the public to be honest when the health department contacts them. And if somebody is at work or a customer at a business, we then look at the specifics of that exposure. And then from there, we can determine whether or not there's a risk to the community. If there's only risk to other employees or no risk at all, then we just work with that business.
Thank you so much. And one more question for Mayor Pope. You mentioned the softball tournament coming to Lubbock this weekend, and they're taking protocols and everything that we can learn from. But does it worry you a little bit that there's several teams coming from out of state, Colorado, New Mexico, those type of places?
No, not particularly. I mean, we have college students that come in and out of our community from other communities. I mean, if they'll follow the protocols put in place, I think they can play softball safely. We've got to find a way to coexist with this virus, and it can't be just damn the torpedoes, we're going to go back to life prior to March. We've got to change our behaviors, and that's something that we can do. We've proven that. We can't lose sight of how important it is.
Thank you so much. I appreciate it.
You're welcome. Thank you.
Thank you, Brady. Now we have Matthew Stell with KMAG.
Thanks, Lacey. I've got two quick questions. Probably both of them are for Catherine Wells. Catherine, we've had a few viewers that have called in and said they've been to certain restaurants and certain places of business, and those employees they're not wearing their mask properly or not wearing masks at all. And so they feel like there should be some sort of hotline or an email that citizens and residents can call just to report on that. I imagine there is one, and just if you could just let us know what that number is or email is and how folks can get connected. Yeah.
Well, they're welcome to call the health department, 806-775-2933. The other thing I'd say is that if they're going into a business and the individuals in that business are not wearing a mask, then they should go to a different business. We have choice in where we go. It's very important that we support those businesses that are taking those steps.
Gotcha. Okay. And my second question is, we know some places like Crickets and Chimmy's and Atomic, some of those places off of Broadway are undergoing some level 3 voluntary cleaning. Can you just explain what level 3 cleaning is in comparison to possibly other levels? For folks who may not understand that, what does level 3 cleaning mean?
So a level 3 cleaning is kind of the deepest clean, and that's bringing in a professional cleaning company to do that environmental cleaning. This would be a better answer for environmental health to handle directly, but it is that deepest cleaning.
Okay, thank you.
Okay, thank you, Matthew. Now we have Casey Ellingson with Texas Tech Public Media.
Hi, sorry. So my question is for Mayor Pope. If cities are given back more control, I'm curious what that would look like here in Lubbock.
I don't really care to talk about hypotheticals. I don't think that's going to happen. The control we have right now is on groups of more than 500 people. The governor's asked us to be involved in that process. In fact, that's why we're working with the soccer tournament, softball tournament this weekend. We were made aware this morning of a Tejano concert this weekend that is in a location that could well have more than 500 people. It's something that we're very concerned about, and we're taking measures this morning to make sure that we see a safety plan for them. So that's our role. That's the role we're going to play, and I would not expect us to have more responsibility than that.
Okay, thank you.
Okay, thank you, Casey. Now Matt Dotre with the Lubbock Avalanche Journal.
Everyone, I think this question is for Dr. Cook. Dr. Cook, I want to ask you about hospitalization rates. So this is something that we look at every week, and the reason, and I feel like there's a large segment of the population that's discrediting the high number of cases because the hospitalization rate continues to be low. And I mean, with that thought process, I feel like by the time these people admit that the hospitalization rate is at an alarming number, then it's going to be too late to fix anything, because hospitalizations kind of happen retroactively. And if people don't show symptoms for a week, then all of a sudden hospitalization rates are really high and they're just going to skyrocket from there. So I know that's a long-winded question, but help me understand at one point you are going to be concerned, like, is there a number of hospitalizations that will cause you to be alarmed? And what is that number?
No, Matt, it's not such a number. It's perhaps a rate of rise. That's sort of what we look at. And yes, I do have concern that with this infection rate or our positivity rate going up significantly, that is concerning. And I know that the hospital administrations, I'm in contact with them, are watching that closely. Now, a few months ago, several weeks ago, we went through a lot of practice runs and looking at stuff and what we would do and where we would put patients if that came about. Fortunately, it did not. However, it would be very easy to ramp that back up again should we need it. Now, in this patient population where we're seeing a lot of our numbers right now are otherwise fairly healthy individuals, majority of them versus 60 to 80-year-olds. So they're going to fare very well. Again, as I said earlier in my part of the press conference, my fear is that one of these individuals who doesn't have a lot of symptoms is going to go to work in a place or expose somebody that works in a place of where there's vulnerable patients. And so in that scenario, it does concern me. We've already had that scenario once here in Lubbock. We don't want to go back to that. And so it is concerning there. It does take time after we see an infections or number of positive cases go up. It's going to take 8 to 10, 14 days for us to see those individuals get sick enough to be in the hospital. This group is going to fare very well. So it's my concern that they would infect individuals who won't fare as well with this infection. So all the more reason, as I said before, social distancing, facial coverings, wash your hands.
Absolutely. Okay, thank you. So, and then, Ms. Wells, I want to talk with you a bit about these 20 to 29-year-olds. Well, I guess first, are these tests, are these 20 to 29-year-olds showing symptoms, or are these kind of more proactive tests that the health department is doing?
No, these are individuals who have either come to one of our clinics, UMC or Covenant. So most of them have symptoms. A lot of them are milder symptoms than what we see in older adults, but there's definitely symptomatic individuals in this group.
Okay, and it's my understanding that these 20 to 29-year-olds or 10 to 19, whatever, anyway, these younger individuals, most of the time don't show symptoms. So I guess then with that being said, like, how would you assess the situation in Lubbock if 127 20 to 29-year-olds have tested positive in the past 14 days, but most 20 to 29-year-olds aren't going to show symptoms and therefore aren't going to get tested?
That brings up a good point. There are lots of individuals, more than we know about, in that age range that are probably symptomatic. And in our release yesterday, when we talked about many of these bars, doing a voluntary closure, I also included there that anybody that has frequented those bars, I recommend that they stay home for the next 14 days and monitor for symptoms. And don't go visit dad, grandpa on Father's Day, and really avoid any of those high-risk individuals.
Okay, thank you, Matt. And our last media question is Olga Guerrero with El Editor.
Good afternoon, everyone. If I just wish that a role would be a little bit more intact in knowing which businesses are not following protocol. It's just sad to know that it takes cases in order for that establishment to be recognized. But that's not my question. My question would be for the doctor. Doctor, I'm under the impression that the more testing we do, the peak should be going down because we're to isolate, quarantine, and trace, and that should be bringing that peak down. Is that correct, or is that wrong?
No, not necessarily. It depends on what patient population you're testing. If you're just testing a group to see what the prevalence of the disease is, say we go out like we did with the nursing homes. That was a state mandated thing, and we had already done a lot of those with our previous experience to make sure that we isolate and keep and know what's out there. Now, most of the ones that we're testing now are individuals that are symptomatic or have been exposed, or they have just been exposed, or they're concerned that they were at one of the bars or one of the eateries or whatever. And so, oh, I was there, I got to go get tested. And so we're seeing a lot of that. They're concerned that they may have been exposed, so they're getting tested. So it's not, that's two different scenarios. One of those is looking for disease, and this one is making sure they don't have disease.
Okay.
That makes sense?
Yes, sir.
Okay.
The second question is for the mayor. I know, Mayor, you don't want to go backwards. We don't either. But if common sense is not being worked, like we're saying, face masks, wash your hands, social distancing, what will it take for you to consider going back if we need to?
Well, I think I've already had that question asked today, Olga. I really don't want to try to answer a question based off hypotheticals. I do believe that we have proven that we know how to slow the spread of this virus, and we've got to return to those kind of practices. We will continue to take a very consistent and a hard stand on those places where we have outbreaks of virus, and help get those places clean, and help make certain that the employees and the guests or customers of those businesses know that they've been exposed, and make sure we get them tested. And if they've got the virus, we need to get them isolated so they can recover.
Thank you.
Thank you, Olga.
Okay, this concludes our news conference. Thank you to our media partners, and thank you to our panelists and our interpreter. You can find daily updates on the coronavirus in Lubbock at mylubbock.us/COVID-19. We'll see you next time.
Thank you.